Hello, I'm Sarah Willis, Paramedic 3 with Frederick County DFRS. Today I'm going to go over the HEPA Exhalation Valves that have been placed on all ALS units as of yesterday, March 29, 2020. These valves are used to trap 99.9% of bacteria from being exhaled into the environment and 99.7% of viruses from being exhaled into the environment. One downside to these devices is they can reduce the flow of oxygen going in and out of your patient. So you may need to increase O2, especially doing inline nebulizations. Some other important factors about these things is that they're a one-time use device. They're sterile in package. They have 2 different size outlets, and they will only plug into your ports one way. So if it doesn't fit one, just spin it around and it should fit on the other side. These are not going to be utilized on CPAP patients. That will be coming out at a later date. These are used for bag valve mask, nebulized treatments, intubations, inline nebs, those type of patient needs. If you refer to Information Bulletin 20026, these were placed on the units. They are only carried by the ALS units, and they're being restocked on a 1-for-1 basis by the EMS supervisors. And something to really take note is they must go on after the medication because they will filter the medication because they're such a fine filtration system. So if you're doing an inline neb or a neb, make sure your filter's in the correct place and they're actually receiving their medication. These are going to be used on high-risk patients, patients with communicable diseases, and all COVID-19 respiratory patients. Next, we're going to go over the valve itself and how it attaches to the different devices that we need. So your valve is going to come packaged just like this. You will find it in the nebulized treatment pocket of the red bag. You should have one in that pocket at all times. This valve comes out of the packet. It is one way. To attach it to a bag valve mask, you have your traditional bag valve mask. You're going to take the mask off, take your filter, and the large end is going to fit onto the bag valve mask, and then your mask goes onto the small end. As you bag through, air will travel through. As you relax the bag and the exhale, nothing will continue to come out as it's blocking all of those viruses and bacteria. So that's what it's going to look like on the bag valve mask. As we move on to advanced level skills and we start adding more things, we're going to look at utilizing it with a neb treatment. When you set up your standard nebulizer, you have the mouthpiece, you have the exhalation tube, and you have your medication chamber. We're going to remove the exhalation tube. We are going to place the large end of the valve onto it, and you do not need to put the exhalation valve back on it. You can run it just like this. Key to remind all your patients is to make a firm, secure seal with their lips and try not to exhale outside or around it. You want them to exhale through this, so we're trapping all of their exhalations within the filter. All right, as we move on from this, we're going to move on to what happens when you intubate someone. For intubated patients, we're going to apply the inline neb. This connects to the ET tube. You have your exhalation port, you have your med cup. This is where you're going to attach your filter. Small end goes into the nebulizer, large end goes into the BVM, and it should look like that. The filter is always going to be closest to the bag valve mask. The medication is always going to be closest to the patient. Again, we don't want the filter to filter out the medications. So ensure your filter is the farthest away from the patient. If you have any questions, don't hesitate to reach out to the EMS supervisor or any of the training staff. We are on a limited supply. They'll be given out on 1-by-1, but we do have a couple now that are open. If you'd like to look at them, please contact EMS 901 or 902. Thank you for your time. Have any questions, please don't hesitate to ask. Have a good night.